Hello, my name is Dr. Erica Stringer Reasor, and I'm an assistant professor at the University of Alabama at Birmingham. And today I'm going to give us a small lecture on breast cancer risk factors. I do want to thank Total Health Conferencing for inviting me to give this very well-needed education, especially during the month of breast cancer awareness. So I do want to discuss first the overview of the lecture, which is what is breast cancer? What's the incidence rates of breast cancer? What are some of the causes and risk factors of breast cancer? What are some of the symptoms that you should be aware of? What's the deal with genetics and hereditary links to breast cancer, such as BRCA1 or BRCA2? And are there any early detection and treatments that anyone that's diagnosed with breast cancer should be aware of? And then I want to end with some conclusions and action points on how we can take control of our own healthcare and be vigilant about educating ourselves about breast cancer awareness. So what is breast cancer? It's the uncontrolled rate of cellular growth that happens with aging. So if you look on the diagram below, your breast tissue is made up of mostly fatty adipose tissues there. If you breastfeed, there are milk glands called lobules, and that milk leaks down the duct and out the nipple areolar complex. So most breast cancers begin in the ducts and can be called ductal carcinoma in situ. If they go out of the ducts and invade the fatty breast tissue, that's when it becomes an invasive breast cancer. So about 75 to 80% of all breast cancers actually originate inside the duct, and about 15 to 20% actually start in the lobules. There are a handful of breast cancers that actually can originate from both the lobules and the ducts, and those are called invasive mammary carcinomas. So there are many abnormalities that can happen in the breast that can be called tumors, but not all tumors are cancerous. So it's important to note that if you find something abnormal in your breast, to go to your healthcare provider, because it doesn't mean that it's always cancer, but it may need to be something to be evaluated. So if we look at the statistics of cancer in the United States, women are more likely to be diagnosed with breast cancer. So there's a 15% incidence of new breast cancer cases if you look at all cancers in the United States. And about 276,000 cases of breast cancer are diagnosed in 2020, and about 42,000 deaths are expected. Now, lung cancer is still very prominent in the United States due to tobacco use, and actually causes more deaths than breast cancer. So about 135,000 patients die of lung cancer a year. Men are not exempt from breast cancer, although very rare. 1% of men can be affected with breast cancer. So nodules on the breast or abnormalities on the chest wall for men should not be taken lightly and should be evaluated. The average age of breast cancer is 62, but in my clinic, I often see patients that are under the age of that. So my youngest patient is 19, and my oldest patient is 101. So again, being aware of these breast cancer statistics, yes, you're more likely to be diagnosed with breast cancer around your early 60s, but also being vigilant about getting your screening exams earlier. So about 5% of cases in women under the age of 40 have been noted or accounted to due to breast cancers. So there are some disparities in breast cancer that we have noticed over the last decade. It used to be prior to the 2000s that we noted that if you were of Northern European descent, you were more likely to be diagnosed with breast cancer than if you were of African descent. But over the last decade, we've noticed that the incidence of breast cancer is both the same in both Black and white women. Unfortunately, Black women are 40% higher chance of dying from their breast cancer than Caucasian women. And we want to know, why is that? We do know that Black women are more likely to be diagnosed with a triple negative breast cancer. This is a subtype of breast cancer that is negative for expressing any of the female hormones. And these tumors usually grow faster and at higher risk of recurrence. And Black women tend to be more likely to be diagnosed with triple negative breast cancer at all ages. So not just the very young, before the age of 45, but even Black patients in their 60s. So breast cancer rates did go down in white women by 2% in ages 60 to 69. And we think that is, again, due to preventive measures like screening, mammography. But unfortunately, it's only gone down by 1% in Black women. So, what can be done to bridge the gap and change the gap in these disparities among all women and of all ages? So first thing we know is being educated and aware of these risk factors. So certainly women are more likely to be diagnosed with breast cancer. Again, breast cancer is a diagnosis of aging cells. So certainly if you're over the age of 60, you're more likely to be diagnosed with breast cancer. If you have a personal or family history of breast cancer, again, you're more likely, to be diagnosed with breast cancer. So knowing your family history, if you have it available, and if you've had a personal history of breast cancer, again, following up with your physicians diligently, as you're more likely to have a second breast cancer in your lifetime. As women are going out into the workforce, many professional women are delaying having children, and we know that having the menses before the age of 12 and having a late menopause after the age of 55, so ovulating for a longer amount of time, puts you at increased risk for breast cancer. And again, because if you choose to have kids after the age of 30, you're not stopping that menses. And again, that overovulation is a risk factor for breast cancer. Patients of high socioeconomic status, so more westernized countries, United States more so than third world countries, are going to be more likely to have breast cancer risk factors, and this could be a component of lifestyle and environment, etc. We also know that patients that have had abnormal biopsies before, so these, again, not all biopsies that are done are cancer, but they can be what we call pre-malignant. So if left alone, they can turn and transition into cancer. So if you've had an abnormal biopsy of atypical ductal hyperplasia or larger lobular carcinoma in situ, that can put you at increased risk for breast cancer. We also noted that disc breast tissue can also place you at a higher risk for breast cancer. Some of that may be due to mammograms not being able to clearly define breast cancers when you have disc breast tissue, and those patients may also need more MRIs. We also see this in younger patients and minority patients have dense breast tissue. So again, there may be some suboptimal imaging or better imaging that those patients need to uncover their diagnosis. Lastly, previous radiation to the chest wall. So again, this may have to do with some patients that may have had certain cancers when they are younger, cancer to the thyroid or to or lymphomas that may have had radiation to the chest wall for a apparent reason, are at higher risk for having breast cancers starting at the age of 30. So certainly knowing that risk factor is important. What we put into our bodies are important too for breast cancer risk reduction, as we know that estrogen replacement therapy can cause breast cancer, diets high in saturated fats, obesity, and an increased alcohol consumption. So I highlighted some of the risk factors that we can change. You certainly can't change anything about, your age, your genes. You can't outrun genes, etc. Or, even perhaps when you have kids. So, but we can modify our diets and take control of how much, what we put into our bodies as far as alcohol consumption and replacement of hormones. So, again, these are some modifying risk factors that we certainly can work on to maybe change outcomes in breast cancer. So next, we're going to talk about genetic testing because that's important. You know, who should get genetic testing? Who should be concerned about genetic testing? So the first thing takeaway I want you guys to know is that 90% of all breast cancers are totally spontaneous and are not linked to any hereditary cancer syndromes. But there are about 5 to 10% of all breast cancers that are linked to hereditary risk factors. And if you have those genes or overexpress those genes, then we know that you can be at as high of a risk of recurrence or a risk of having breast cancer as 40 to 60%. So, you know, if patients had that information, they may want to act on that information to change the risk of breast cancer. And I think that that's a piece of knowledge that many patients would like to know about. So Angelina Jolie and her family, you know, came out and discussed about the BRCA1 and 2 gene and how she prophylactically decided to remove her breast because of her strong family history of breast cancer and other cancers. She did have an overexpression of one of the BRCA genes. There are other genes besides BRCA that may be important that may increase your risk of a hereditary breast syndrome by 10% in your lifetime. And those are listed below, such as CHEK2, PALB2, ATM, BARD1. Again, if patients knew they had that information, they may want to act on it. And I think that it's important to talk to your doctor about if you should be tested if you have a strong family history of breast cancer or any cancer like ovarian, prostate, or pancreas. So what are the symptoms of breast cancer? Everyone always thinks that it has to be a lump, but it's not necessarily always a lump. Most breast cancers are painless breast lumps, so they have nothing to do with pain, but some breast lumps can be painful. And, you know, I do want to tell and advise patients that depending on where the breast mass is, it can be a little tender. So we know that breast mass are often found in this kind of right upper outer quadrant, right below the armpit, where you may shave under your armpit. That's kind of the quadrant that most breast cancers are found, and those tend not to be painful. But breast lesions that are close to the nipple areola area, you know, as that areola complex tends to be a little bit more sensitive, can be painful. So, you know, we don't want to mistake that for an infected milk duct or something that's totally benign. We, again, you know, bringing awareness that you should, if anything's abnormal on the breast or the skin, that you get it followed up by a physician. Nipple discharge can be abnormal and can be seen in non-invasive and invasive breast cancer. So if there's bloody or a liquid discharge coming from the nipple, and particularly, you know, concerning if it's just one nipple and not the other. Again, getting this evaluated by a healthcare provider. Inverted nipple or sunken in nipples are also important to note too. So if that's a strict change for a patient, like this patient in this picture, you know, again, discuss with your healthcare provider. Redness of the skin, changes in the texture of the skin. So if you look in the right lower quadrant there, that's changes of the texture of the skin. And, you know, it looks like a peeled orange, the rind of a peeled orange. And so again, if that's new, you want to have that evaluated too. You also want to compare the symmetry of breast. So we know that naturally breast symmetry may be different between one side to the other. But if there's a staunch change in the size of the breast, again, you want to have this evaluated immediately. And then lastly, you know, breast cancers don't just have to be up under their, you know, the upper outer quadrant, but certainly they can be central lumps. They also can occur right up under the collarbone or close to the sternum. So you want to be able to give yourself a breast exam that encompasses all of that chest wall. Breast cancer subtypes can be certainly different. They're all different types of breast cancer. So if you look at the pie square there, most breast cancers show overexpression of the female hormones estrogen and progesterone. and about 10 to 15% are triple negative, so have no hormone expression at all, and actually HER2 negative. And then about 20% of those breast cancers are HER2 overexpressing. So HER2 is a protein that's also seen in the breast tissue, but it's also noted in the esophagus and the gastric tissues as well, and too much of that protein can cause cancers. And so we found out from many scientists like Chuck Peru that, you know, these breast cancers not only have a protein expression, but they also have a DNA fingerprint. And if you look at that heat map there, you can see that there's several different types of breast cancer beyond hormone receptor positive or hormone receptor negative. And so by categorizing or subcategorizing these breast cancers, us physicians have been able to provide better treatment options to individualize care to patients. So, you know, what is so important about breast cancer and the strides that we made over the last 2 decades? Well, we know that early detection is key, that most breast cancers are found in early stages where they're curable. And in fact, if you get diagnosed with a stage 1 breast cancer, you know, your outcomes are extremely good, and even stage 2. And so, you know, you're talking about in 5 years survival greater than 90%. So we know that early detection is key, and screening mammogram saves lives. If you ever haven't had a mammogram or you haven't had a mammogram yet, it feels like a X-ray. So it's a machine that takes X-rays of the breast, and it squeezes the breast from the horizontal and longitudinal side. There is quite a bit of pressure when you get those tests, but it can be a very good screening tool for many patients. And so we recommend that you get your screening mammograms beginning at the age of 40 yearly. Now, when you are younger than 40, and we recommend that you do a self-exam. As we know, about 85% of patients that have a palpable breast nodule feel it themselves and present to the physician. And so here you can see a mammogram where there's a nodule seen on the breast, and at that point, there's clear distinction between that nodule and the healthy tissue surrounding it, and that patient will move on to have further testing. You can see here that mammograms are not always, you know, created equal. So if you look at these imagings of a patient that are undergoing breast a mammogram, you can see the patient on the far left. It has a very clear picture. And so this is probably an older patient over the age of 60 that does not have dense breast tissue on her mammogram. But as you go on to the second, third, and fourth mammogram picture, you can see how these patients have much more denser breast tissue and can be quite hard to read through that mammogram. And so knowing the category of dense tissue on your mammogram is key, because category C and D breast cancer densities on mammograms are recommended that they get further testing like ultrasounds of the breast or MRIs. So knowing your report and going through your report with your provider who ordered the test is again key to knowing, do you need further imaging for clarity. So breast self-exams are recommended monthly. You know, usually it's best to do the breast exam a couple days after your menses, as that yields a more reliable test. You know, it's always good, again, to do a visual inspection of the breast, feel around the frontal section of the breast, under the armpits, closer to the collarbone, and also to the sternum, and notice any changes. You know, again, notice the symmetry, notice if there's any skin changes, because cancer is not always just lumps or bumps. It could be, again, as subtle as skin changes. and know what's normal for your body. You know, some women have, again, inverted nipples and they've had that since they were 18. Well, that's not abnormal, but again, a new inverted nipple or a change in your clinical exam can be something new and concerning. You know, after you receive a mammogram, if there are any abnormalities noted on your mammogram, your provider may recommend further testing with the ultrasound, or if you have dense breast tissue. Again, this helps physicians know, is that mass or nodularity in your breast something that should be concerning, or is it, you know, just something benign like a cyst? So, you know, oftentimes young women and women of all ages can get cysts in their breasts, and sometimes this cyst can correlate with your menses. And as you can see there in the ultrasound picture below, that if there's no solidness to there, you know, it's most likely benign if it's fluid. But if we can see blood vessels going through there and it's a solid texture, that may be more concerning for a cancer and may need further evaluation. Next, if you look at more definitive tests such as MRI, that may again be recommended for screening or for evaluation of a mass if you have breast dense tissue, and this will also evaluate the diseased breast versus, you know, just normal breast tissue. So you can see here on the bottom right picture, a patient has a mass that we probably could clearly palpate or feel on exam in the lower quadrant, but there also is a smaller satellite lesion that's identified with the arrow. So again, this may have implications on what she needs to do as far as a treatment plan. So up above is how you would sit in an MRI scan. You would lay flat on your belly. So if you have difficulty laying flat on your stomach, this may not be the most comfortable test for you. It is going into an enclosed space. So if you have claustrophobia, that may be a concern, and you may need your physician to give you something to help with that claustrophobia. And you can see that you would put your breast almost pretty similar to if you were getting a massage there. Put your chest flat down and head flat down, so we can get better imaging of the breast. If indeed a mass is found or some abnormality, you may have to go in and get a biopsy, which is a small needle that the physicians insert into the tissue, again, to evaluate it for cancer. So treatments, you know, have come a long way in the last couple of decades, and again, can be life-saving. And so most patients that have early stage breast cancer may get some combination of surgery, radiation, and chemotherapy, and may also be recommended targeted therapies as hormone blocking therapies. Again, this is individualized per patient and may be dependent on the type of surgery that you choose. Again, you know, when we talk about treatments, what the doctors can do as far as surgery and radiation and chemotherapy and maybe a hormone blocking tablet later, there are some lifestyle modifications that you may be able to do to prevent breast cancer, or if you were diagnosed with breast cancer, reduce your risk of seeing it back again. So, you know, the American Heart Association and American Cancer Society recommend exercise for about 150 minutes per week. You can break that exercise down to however minutes a day that you choose to do it. You can do it daily, or you can pick 3 or 4 days to do it out of the week. You know, the summation of this is get your heart rate up and perform exercise for 150 minutes. You know, doing exercises like running or walking, those weight-bearing exercises, lifting weights, actually also provide, you know, some extended coverage to increase bone density. So those are some of the exercise techniques that are recommended. But if you have bad knees or arthritis, using an incumbent bike would be recommended. Next, keep a healthy weight. If it's by, again, exercising or taking in a low-fat diet, that's recommended. Diets high in antioxidants, so lots of green leafy vegetables. Berries are important too, blackberries, blueberries, again, as it helps to get rid of the free radicals in your body and actually also helps with energy boosting and cellular repair. So again, cancer or breast cancer is a diagnosis mostly of aging cells that don't repair themselves well. So taking in some of those foods high in antioxidants may help your body naturally prepare those cells. We also recommend, limiting alcohol use again, as that's a lifestyle modification that we can do to decrease the risk of seeing breast cancer. Also avoid hormone replacement therapies. In the 70s and 80s, hormone replacement therapy, really got its name after women were having their ovaries and uterus taken out for fibroids and for other abnormal uterine bleeding. And it made patients feel younger and better. Their joints felt better, their skin felt better, their mood was better. But of course, over the decades, we've noticed that places that excess estrogen placement puts women at increased risk for breast cancer. If you are able to, we do recommend that you breastfeed your children when possible, as we also know that that's risk reduction in seeing breast cancer. And then do whatever you can to minimize stress. So if it's exercising, is it taking a minute from the kids to do something that you love, like reading a book or, sitting out on the deck and having your green tea, by all means do it. And you can see this nice young lady in the bottom is enjoying a spa treatment. So don't be afraid to, embellish yourself and take good care of yourself. So how has the pandemic changed health? Well, we noticed that in March and April and May, screening mammograms drastically went down. And we know, again, that early detection is key. So education and being able to have the access to obtain these mammograms. So, the National Cancer Institute noted that delays in screening in both breast cancer and colorectal cancer may cause up to 10,000 deaths in the next 10 years due to the pandemic. And so now all of us who are providers are encouraging patients to get back in and get your screening mammograms, again, because we know that that is one metric that certainly saves lives. And so, we do want our patients to feel safe and as well as our staff to feel safe. So some of the safety measures that our institution and other institutions and community practices have been doing is checking in with the patient, 24 hours to 48 hours before the health visit by phone and asking patients about their symptoms. Are you having fever? Are you coughing? Have you been around anybody that's been diagnosed with COVID? There's also safety measures in place for healthcare providers. Many of us are doing daily health checks or every other day health checks via our cell phones, where we check in and again, answer some of those same questions because we want your providers and the staff, the office staff, to be safe and not spread COVID. So again, this is about keeping patients safe and giving them the access to care that they need. Most clinics, when you walk into the clinic, there are temperature checks before you enter the door. If your temperature is abnormal, we will ask you to reschedule. And like you're doing already in the community, wearing face masks, washing hands, physically distancing when you're in the clinic. And additionally, allowing some patients that are at low risk for obtaining COVID at high risk for obtaining COVID, to do some video and phone visits to decrease the amount of patients in the waiting room. So again, safety measures are in place for this. For our patients that are having to undergo breast cancer treatment during the time of COVID, we are actually doing COVID testing prior to procedures. Again, keeping the patient safe and also ensuring the safety of our staff. So some of the key takeaways I really want you to leave from this discussion today is really know your risk factors. You know, if you know your risk factors, you're able to implement and have conversations and dialogues with your physician to advocate, do I need genetic testing? Do I need to start my mammograms at this age? Do I need to obtain MRI screening? Again, these are all important questions for your provider and for providers to know how to treat the patient. Also, again, you know, you can't outrun genetics, right? But you certainly can implement some healthy lifestyle changes that may cause us to prevent us from getting breast cancers or even other cancers. And then lastly, early detection is key. You know, continue with your monthly self-breast exams. Notice any skin changes, because breast cancer doesn't always have to look like a breast lump, but it may just be subtle as skin changes or discharge from the nipple. Really stand on task and stand on time for your screening mammogram. Again, as there are some breast cancers that can grow quite quickly, and screening mammograms every year, again, is an intervention that we know saves lives. And if you are to have an abnormal mammogram, please seek intervention because most things that are found on a mammogram may not be cancerous, but it may be something that requires intervention. So again, I hope that this lecture has given you some knowledge that maybe you didn't have before. There are many websites that are available that have additional knowledge and information that may be helpful to you, family members, or staff members. So please evaluate those to learn more. And thank you so much for your time and participation in this conference.